Have you ever wondered why some people, regardless of age or gender, might experience unexpected leakage of urine? This is urinary incontinence, an unintentional loss of urine affecting over 33 million people in the United States alone. It's not just a physical problem, but one that can impact self-esteem, social interactions, and quality of life, with types ranging from stress urinary incontinence to urge, overflow, functional, transient, and mixed incontinence. If you've ever been curious about this, you're in the right place to find answers. Let's delve into the first type of urinary incontinence, stress urinary incontinence, or SUI, as it's often referred to. This condition is characterized by the unintentional loss of urine during physical activities or exertion. It's like a tap that leaks when you apply pressure. Only in this case, the pressure comes from actions like coughing, laughing, exercising, or even lifting something heavy. So what's the cause behind this involuntary leakage? Stress urinary incontinence occurs when the pelvic floor and sphincter muscles, which control the release of urine, weaken. This weakening can be the result of various life events and conditions, such as pregnancy, childbirth, obesity, and aging. It's like a door that doesn't shut properly because its hinges have become loose over time. Now, onto the symptoms. The most common one is, of course, the leakage of urine when you exert yourself. This leakage can range from a few drops to enough to soak through your clothes. It might be inconvenient, uncomfortable, and at times a little embarrassing. But remember, it's a medical condition and not something you have to accept as a normal part of life. So, what can you do about it? Well, there are several treatment options available. Lifestyle changes are often the first line of defense. This might include reducing your intake of caffeine and alcohol, losing weight if you're overweight, or quitting smoking. Pelvic floor exercises, known as Kegel exercises, can also help strengthen the muscles responsible for urine control. In some cases, medication, medical devices, or even surgery might be recommended. For example, a doctor may suggest a pessary, a device inserted into the vagina to support the bladder. Surgical options include sling procedures, bladder neck suspension, and prolapse surgery. Remember, stress urinary incontinence is common but treatable, so don't hesitate to seek help if you're experiencing these symptoms. Next on our list is urge incontinence. This type of urinary incontinence is a bit more complex, as it's often linked to an overactive bladder. Imagine your bladder behaving like an overeager alarm clock, sending out signals to urinate far too frequently and at times with such urgency that making it to the bathroom becomes a race against time. Urge incontinence doesn't discriminate. It can affect anyone, male or female, young or old. So what causes this? Various factors can play a part, but it's often associated with conditions that affect nerves and muscles, such as neurological disorders, bladder abnormalities, or even diabetes. Interestingly, mood disorders like anxiety can also influence this condition, as stress can exacerbate the urgency and frequency of urination. As for symptoms, they can vary from person to person. The most common one is a sudden, intense urge to urinate, followed by an involuntary loss of urine. This can be particularly problematic at night, leading to disrupted sleep due to frequent trips to the bathroom. So, you may be wondering, how is urge incontinence treated? Well, like other forms of incontinence, treatment is tailored to the individual and the underlying cause. Lifestyle changes, such as reducing caffeine and alcohol intake, can help. Pelvic floor exercises, also known as Kegel exercises, can strengthen the bladder muscles and improve symptoms. In some cases, medications might be prescribed, particularly for those with overactive bladders. And in severe cases, surgery may be considered. Remember, it's paramount to consult with a healthcare provider who can properly diagnose the condition and guide you through the best treatment options. Urge incontinence can feel like a hindrance, yes, but with the right treatment, it can be managed effectively. Now let's shift our focus to overflow incontinence. This type of urinary incontinence is quite interesting, as it's about the bladder not emptying completely, leading to a constant dribble. So why does this happen? Well, there are several reasons. A common one is a blockage or obstruction in the urinary tract, which hinders the flow of urine. Another cause could be weak bladder muscles, unable to contract effectively to push out all the urine. Certain conditions like diabetes, spinal cord injuries, or prostate gland problems can also contribute to overflow incontinence. The symptoms are somewhat unique. Unlike other types of incontinence where there's a sudden urge to urinate, overflow incontinence is marked by a frequent dribble of urine. You might feel like your bladder is always full, even just after using the toilet. There can be a weak or dribbling stream of urine, and you might find yourself urinating more frequently, especially at night. As for the treatment, it's essential to first identify the underlying cause. If it's due to a blockage, procedures to remove the obstruction might be required. In cases where weak bladder muscles are at fault, medications can be used to improve their function. Catheters are another option, helping to ensure the bladder is emptied regularly. Lifestyle changes can also play a role in managing overflow incontinence. From maintaining a healthy weight to avoiding bladder irritants like caffeine, alcohol, and acidic foods, there are several ways to help control the symptoms. Pelvic floor exercises too can strengthen the muscles involved in urination. Remember, it's crucial to consult a healthcare provider for a proper diagnosis and treatment plan. Overflow incontinence may be frustrating, but with the right approach, it can be managed. Functional and transient incontinence, though different, are important to understand. Let's delve into functional incontinence first. This type is not so much about the bladder's ability to hold urine, but more about the physical or mental obstacles that prevent one from reaching the toilet in time. Aging, disability, or cognitive impairments, such as Alzheimer's or Parkinson's disease, often play a role here. The symptoms, therefore, are not so much about the bladder, but more about the inability to get to the bathroom promptly. It might involve difficulty in mobility or confusion about where the bathroom is. Treatments for functional incontinence are often targeted at the underlying physical or cognitive issues. This could involve occupational therapy to improve mobility or cognitive therapy for those with memory or recognition problems. In some cases, using mobility aids or modifying the home environment for easier access to the bathroom can be beneficial. Now let's shift our attention to transient incontinence. As the name suggests, this type is temporary and often resolves once the underlying cause is addressed. It's commonly triggered by certain medications, urinary tract infections, or even high caffeine or alcohol consumption. In these cases, the symptoms are usually frequent and sudden urges to urinate, and these symptoms disappear once the cause is eliminated. Treatment for transient incontinence is typically straightforward and involves addressing the underlying cause. If a medication is to blame, your healthcare provider might adjust the dosage or switch to a different drug. If an infection is causing the issue, antibiotics are usually prescribed. And if lifestyle factors are the culprits, reducing alcohol or caffeine intake might do the trick. No matter the type, remember that incontinence is not a personal failing but a medical condition that can be addressed. Lastly, we have mixed incontinence, a challenging condition that combines the characteristics of both stress urinary incontinence and urge incontinence. Imagine standing on a tightrope, trying to balance the unpredictable urges of your bladder with the physical demands of everyday life. That's what living with mixed incontinence can feel like. This condition is often a result of weakened pelvic floor muscles in combination with an overactive bladder, the double whammy. Symptoms may include unexpected leakage during physical activities and sudden intense urges to urinate that are hard to control. In addition to these symptoms, the person might also experience frequent urination and nocturia, which is the need to urinate multiple times during the night. It's like having an internal alarm clock that just won't let you sleep. Risk factors for mixed incontinence include pregnancy, childbirth, obesity, aging, and certain medical conditions. It's a bit like playing a game of chance with your body, where the dice are loaded against you. But don't lose hope. There are ways to manage this condition. Treatment options for mixed incontinence are as diverse as the condition itself. They can range from lifestyle changes like a healthy diet and regular exercise to pelvic floor exercises designed to strengthen the muscles that control urination. Medications can also be used to manage symptoms, and in some cases, medical devices or surgery might be recommended. It's important to consult a healthcare provider for a proper diagnosis and treatment plan. They can help determine the severity of your condition and suggest the best course of action. Although dealing with mixed incontinence might seem daunting, it's important to remember that help is available. It's not an easy road, but with the right guidance and determination, it's a journey that can lead to better control over your bladder and a significant improvement in your quality of life. Now that we've covered the different types of urinary incontinence, let's answer some common questions about this condition. One frequently asked question is, what are the symptoms of urinary incontinence? Well, symptoms can vary depending on the type of incontinence. They can range from urine leakage during physical activities in stress urinary incontinence to frequent and sudden urges to urinate in urge incontinence. In overflow incontinence, you might experience a constant dribbling of urine because your bladder doesn't empty completely. If you're dealing with functional incontinence, physical or mental disabilities might prevent you from reaching the toilet in time. Transient incontinence can lead to temporary urine leakage due to factors like infections or medications. Another question often asked is, what are the risk factors for urinary incontinence? Several factors can increase the risk of developing urinary incontinence. These include pregnancy, childbirth, obesity, and aging, all of which can put pressure on your bladder and affect its function. Certain medical conditions like urinary tract infections or neurological disorders can also contribute to incontinence. Let's move on to treatment options, another common area of inquiry. How is urinary incontinence treated? Treatment depends on the type of incontinence, its severity, and the underlying cause. Lifestyle changes, such as maintaining a healthy weight, limiting caffeine and alcohol, and not smoking, can help manage symptoms. Pelvic floor exercises can strengthen the muscles that help control urination. In some cases, medications, medical devices, or even surgery may be recommended. Many people wonder, can urinary incontinence be prevented? While not all types of urinary incontinence can be prevented, you can reduce your risk. Regular physical activity, maintaining a healthy weight, and avoiding bladder irritants like caffeine and alcohol can all contribute to bladder health. And finally, a very important question, when should I see a doctor? If urinary incontinence affects your daily activities or quality of life, seek medical advice. It's also important to consult a healthcare provider if you experience other symptoms such as blood in the urine, or if you have frequent urinary tract infections. Remember, the first step towards managing urinary incontinence is understanding it. Don't hesitate to reach out to a healthcare provider if you need help.